This is a presentation on anterolisthesis and stenosis of the lumbar spine. Had a severe motorcycle wreck at age 17, and it was life-altering, and then was in a car wreck sometime long after that, and had a surgical procedure, and they removed a huge piece of calcified disc. And so that destabilized it, and it took me years to finally get a fusion. And years after that, needed another surgery for spinal stenosis, for narrowing in the canal. And so they cut enough material away, even though L5 was stabilized to the sacrum, they cut enough material in the vertebrae above that to destabilize that over time. And of course, over time, when you lose motion in one segment, the one above that is going to get quicker wear and tear. Well, guess what? It's been 20 years for me. And my L4 has slid forward 25%. A forward slippage is called an anterolisthesis. And that can be symptomatic. I have to be careful about things that I do, but I have a nice exercise routine that helps me a lot. I know how to self-treat. And I have had in the past cramping in my calves, which makes it difficult to sleep. And then other odd sensations in my in my calves, which I blame on the slippage. And my reasoning was, you have a lumbar curve here, and we have a vertebral segment that has slid forward, and reasonably that stretches the nerve roots and induces a mechanical type of stenosis. And if we could bring that vertebrae backwards, even if by a millimeter or a half a millimeter, which wouldn't show up on an x-ray, it still might be enough to take pressure off those nerve roots. And guess what? It worked. So this is my routine that I use to treat stenosis and a forward slippage. And it's my effort to flatten the lumbar curve. Okay, remember we're fused down here, and get this critter to glide backwards, okay? So, no studies on this exercise. There's no published research, there's no imaging. You only have me telling you that I feel a lot better, and it's easier for me to fall asleep when my legs are not crampy. All right, so this is what I do. I spend about 10 minutes. I do this at least 3 nights a week. And I just explore movement and try to get my lumbar curve to reduce, to flatten out a little bit, and then I try and induce a shearing force. So what I do is I prop this beach ball up against the chair so it's not going to go anywhere, and then I scooch up onto it and I lift my legs up like this. So this is a hamstring stretch, and it takes me about 5 minutes, and all of a sudden I get a release. Now that release could be in the back, could be in the hamstrings, could be in both, right? So this is the first thing that I do, is just do this steady stretch. And when I do the hamstring stretch on the beach ball, I'm able to get a much better stretch than if I simply did that against the wall without the beach ball, okay? So the beach ball is fundamental in taking movement out of the pelvis, as the pelvis can move with the lumbar spine. And it then isolates the lumbar spine a lot better. And for me, it isolates L4. Now, the other thing that I do is I compress into the ball. So I'm tightening stomach, but I'm also tightening my glutes and my spinal extensor muscles. I'm just pushing into the ball, okay, and hoping that by gliding the pelvis back, remember L5 is fused to the sacrum, so L5 is going to glide backwards, and maybe it will pull L4 because it's connected with facet joints, and of course the disc connects L4 with L5. So I'm trying to glide L4 downward towards the floor, okay? And there's a number of things you can do that can feel very therapeutic. And so I like to do about anywhere between 10 and 30 reps of just rocking back and forth, especially knees towards my chest, although I like to tell people to keep the knees apart a little bit. It's actually more effective if your knees are apart by, say, at least 12 inches or so. Okay? I know the literature out there, the magazine articles, the YouTube, all of that stuff, they tell you to stretch your knees to your chest. But I can only go this far, going knees to chest. But if I come out this way, all of a sudden I get more stretch and more posterior rotation. So knees pointing outside the shoulders is very effective. Then I do shifting side to side. I forgot to mention that when you air up your beach ball and you put that stem into it, put a piece north and south and east-west of duct tape, and then that beach ball will never leak. Otherwise, it will develop a very, very slow leak over time. So side to side I do. You can also do little circles. I'm leading with my knees. It's a little tricky to try to lead the pelvis into a circle, but if I do the knees, then that's easier, okay? I will stretch my legs out to the side like this, okay? Just explore movement, rotating legs in and out, knees going obliquely towards the outside of my right shoulder, and then going obliquely to the outside of the left shoulder. And in this position, I feel like when I glide backwards, it's more effective. So this one is, in my opinion, the most effective one, in which we're just gliding the pelvis backwards by pulling the thighs into the pelvis, flattening that lumbar spine somewhat, and maybe gliding that segment that's stuck forward. But anyway, after doing these very recently, I think I started a couple months ago, the leg cramping has abated. And so at night, I don't have these leg cramps that interfere with my ability to fall asleep. So I hope that's helpful to you. I have another helpful YouTube video, and that's using a larger ball, the exercise ball, and it's called Basic and Intermediate Ball Exercises. And then I'm going to add another one called Advanced Ball Exercises shortly on YouTube. I'll stop here. Thank you.